Once you understand the science, everything makes sense. And so, this topic with regards to the setting off of asthma, in truth, it's not just the vax, it's also infection, but one is far more significant than the other. And additionally, you can't control exposure, but you can control your exposure to one, but not the other. And that's why I think this is so important. And here is the story that I'll lead with. Uh, Someone in their, say, late 40s, a lady, had a history of childhood asthma, not had any problems with it for most of her life, never needed an inhaler. Um, and then, so she was fully vaccinated, and then she got COVID. And within a couple of months, she found that her chest was tight. She's starting to wheeze. She needed a salbutamol inhaler. Then she needed a steroid inhaler. And then she found that she actually ended up in hospital needing nebulizers. That had never happened to her in her life. That's the sequence of events that occurs with regards to exposure to spike protein. That's the mistake people make. They say infection or otherwise. I say spike protein. Once you understand this and you understand the mechanisms around it, it will start to make sense. So, what we're going to be talking about today is a very important paper that was done in Taiwan, but actually it is based on American children, the association between COVID vaccine infection and new onset asthma in children. The reality is that this is relevant to everybody. And this is something that we should all, therefore, be quite concerned about because the implications going forward are quite significant. But why does it happen? What really is going on? That's part of what I'll be answering with you. And just a reminder that I had just recently done this presentation. I'm afraid to even say what I was talking about because it got censored. If you want to see it, you can go on Substack and you will be able to see it there. I said the wrong thing in one line, so somebody's watching me. So I have to be very, very careful about what I say because it seems to be annoying the powers that be. The other thing that I want to advise you about is that I want you to be able to join me on this webinar where we're talking about the implications of poor long term immunity and going into more details about that topic that I got censored on. So if you want to join me, please follow the link below in the description. So let's get back to this study. This is a very important study. It was done in about June of this year. And as I said, it was really done in Taiwan, but based on a US cohort of patients. Um, and so they were looking at potential long term effects linked to new onset asthma in children. And so they were looking between the 1st of January 2021 to the 31st of December 2022. Two cohorts of children, 5 to 18 years old, and they were had to have a positive test, and this is one where they were comparing unvaccinated children with vaccinated children directly, looking at the implications of what happens when they get infected. So, this is a very important study. And I've been saying that this is the kind of study that needed to be done very early on in the pandemic. Once we started to, certainly once there was mandates, you would think that they would want to check to make sure that everything they were doing was actually in the benefit of the population. And you have to go back to remember, I don't know if you can remember that early in 2021, there was no focus on the children. It was just on granny and grandpa to protect them. Even late in 2021, in the UK, they said that there was no reason for them to give children, and then gradually it changed. And now we're in that very strange scientific position where, on one side, you have the CDC saying recommendations for use of COVID vaccines in children, group recommended for everyone ages 6 months and older in the United States for the prevention of COVID 19. I'm not sure why they've used this word because it doesn't necessarily stop infection, maybe reduces the risk of severe disease. That's a different thing. So that's the approach in the US. And in the UK, the guide for parents of children 6 months to 11 years at high risk. And they point out who is at high risk: the severe neurodisabilities, immune suppression, learning difficulties, long term serious health conditions. These are the children that they recommend are vaccinated in the UK. And so we come into this strange situation where who exactly is following the science? Are they both right? Well, if you make up the science yourself, then both of them can be right. And that's where we are now. So it's a very strange situation where there doesn't seem to be any clear consensus. But I think that the information that comes out from this is actually very, very important. So, what they then did in this study is that they then looked in detail and they found that there was a significantly higher incidence of new onset asthma in COVID infected children compared to uninfected children, regardless of vaccination status. Okay? So you have to understand that the COVID infection, both in the vaccinated and unvaccinated, there was a higher incidence of new onset asthma. Now, before I go any further into breaking it down a little bit, there's an important piece that you have to understand. And this is now the science that is relevant in terms of the asthma. This is how I describe what happens with COVID. Doesn't matter where the spike protein comes from. What you have is that if you have infection or other sources and you have prior immune activation, one is the spark, the other one is spraying petrol on the spark, and you have this massive inflammatory response. That's effectively what happens for most people. And it doesn't only happen in the lungs, it happens in every single organ system that is affected. So you will find that some people with arthritis will get much worse arthritis. If it's asthma, it will get worse. If they have SLE or some other autoimmune condition, it's likely to get worse unless they're on immune suppression. It's that kind of principle because what happens is that both, it seems, the infection and otherwise has an impact on the immune cells. And the immune cells, especially the regulatory cells, get damaged. They're not as effective in their role. And so if there was any evidence of inflammation before, because the regulatory cells, which are like the peacekeepers, have reduced function, the effector immune cells get more power. And so, therefore, they are able to drive the war. It's kind of like what's happening in the world now. The peacemakers are not very powerful, so the warmongers are getting away, and we are therefore going towards a situation with war. That's effectively how it works in the body with the immune system. The regulatory cells get damaged, and because they are not as vocal, what then happens is that the narrative gets taken over by the effector cells that want to fight, that want the inflammation. That's the example that I think can work. And so then we go back into the paper in a little bit more detail here, is that when they looked at the cohorts, though, in cohort one, the children who were not vaccinated, who had infection, their risk of asthma, so if they got infected, it went from 2% to 4.7%. So that means that if they didn't get infection or obvious symptoms of infection, their risk was 2%. But if they had a clear infection that was confirmed by a swab, their risk of asthma went up to 4.7%. That's almost double the risk. So, this is where I said the bit with regards to COVID infection just being a risk factor on its own is extremely important to understand. This is why I explain to people that don't underestimate that the virus is still circulating. It can still do damage to the immune system and trigger all kinds of inflammatory responses. Getting back to the paper again, but what stands out here is that in this cohort 2, COVID 19 infected children with vaccination showed an 8.3 incidence of new onset asthma. So that's compared to 4.7 in the children who weren't vaccinated. The vaccinated children, it was 8.3%. That is even higher than the children who didn't have. Now, this is important. The children in this group, in cohort group, that didn't have an infection still had a rate of 3.1% compared to 2% in their cohort groups to understand. So, whichever way you take it, this is demonstrating that there is a very clear association with the increased risk of asthma. So from 2% to 3.1% in the vaccinated cohort if they didn't have obvious COVID, and from 4.7% to 8.1% if they did. That is significant. That's extremely significant because when you look at the data here, what they did is that they got all the children in the study were recruited from the Trinetics US Collaborative Network, and it encompassed 64 healthcare organizations across 50 states of the US. And as I said, it was aiming to evaluate the association between vaccination and infection, and the incidence of new onset asthma. And when you look at the cohort sizes, and I'll get this here for you just in a second, but when you look at the cohort sizes, they're talking about large numbers of children that were involved here. And you can see this is the breakdown. And up here is the cohort. You're talking about 128,000 children that were involved. They broke them down into all the categories. One of the interesting things that I found here, 345 of them had nicotine dependence. But granted, this is up to the age of 18, so that makes sense. But look how many children up to the age of 18 had mental, behavioral, and neurodevelopmental disorders. 13.83% in the US. That is humongous. That's really, really significant. So, this has some valuable information inside it with regards to other health conditions that could be quite relevant. And even in terms of endocrine, nutritional, and metabolic diseases, 8.38% of children in the US have that. So that's very, very significant. But the point I'm making is that this is a large cohort. And they did do propensity matching. That means they tried to take out all of the things that were relevant that could skew the data in order to try and clearly identify what were the risks. And when you look again here, what they were talking about here is incidence of new onset asthma in the COVID 19 and non COVID groups. So, regardless of vaccination status, the COVID 19 infected group exhibited a higher incidence of outcomes compared to the non infected groups. And this is what we had said before. So, whichever way you take it, COVID exposure increases the risk. But in the context of their vaccination status, that increased risk is more marked in the vaccinated cohort. Here it says it again. This is in the conclusion. So again, it shows there's a strong link between COVID infection and an increased risk of new onset asthma in children, which is even more marked in those vaccinated. They could have probably highlighted this a bit more, but if you do that, you won't get your paper published, so that's just the reality. But yes, so it's very significant. Now, there was something that was mentioned previously that I'm unable to get some clarification on, and I think it's important for it to be clarified, is that in this study, they broke down in the cohorts 1 and cohort 2, they have it as asthma or death. Now, I would have preferred that they had broken this into asthma as one and death as another group, whether or not the death was from asthma. But the fact that they have put them together, so they have here any asthmatic drugs and death, frankly, this is how you know, and this is how you can hide stuff, by combining all things together. And it was said, by someone, Alex, Berenson, I think it was, who did a similar view of this here, that it was a 6 times higher death rate in the vaccinated cohort. I can't see that. I haven't had enough time to look through to see whether or not I can see if that is actually true. And their assumption is that the vaccinated cohort are more likely to have children who have specific risks in terms of comorbidities and so on. But as I said, this study did try and take out as best as possible all of the factors that would skew the outcomes in a way that could cause people to ignore it. So this is quite significant, and it just raises the question, because a lot of people perceive in children that there are no risks with regards to COVID vaccines, and so therefore just get them vaccinated. And that doesn't play out. That's truthfully, that's not logical in my mind. You give it to the people who are at high risk, and you mitigate the exposure to people who don't really have a significant benefit, because all you're doing is increasing your risk of adverse outcomes. So I don't understand why the political situation pushed that and is still pushing this, even with this kind of evidence out there. I don't know what to say. They clearly, maybe they haven't read this kind of paper. I don't know. Or maybe they're getting other information that they would say would be far more relevant. I don't know what they're looking at in that context, but I do think that when we look at issues like asthma in children, because you are technically playing around with this inflammatory process. I'm telling you, this spike protein is not to be messed around with. And that inflammation that can occur when you have prior immune activation, and I can bet you that what happened is that when you have the combination of a situation where somebody is getting re-exposed to the spike protein through infection, then they are at much higher risk for inflammatory complications. That's essentially what I have always said with regards to the COVID storm. Spike triggered autoimmune response mechanism, still working through a lot of the science around it. But the principle is essentially that the more exposure that you have in the body to this, the higher the risk of inflammatory processes that can cause long term harm. So, in conclusion, please remember that it's important for people to be well informed. And if they choose to go ahead, that's fine, but make sure parents understand the risk benefit equation, and to ask their doctor and ask whoever is giving the injection, what are the risks? And is my child in that high risk group? How do you approach it? It's not wrong to ask questions. And so it's very reasonable, even within the recommendations, to ask a question about what the science is showing. Remember, coming up in just another couple of days, we'll be talking about mRNA, looking at self replicating mRNA and the characteristics with regards to problems about long term immunity. Very important topic that, again, has gone under the radar. So, thank you very much, and I hope that you have a wonderful evening. And until we meet again.